There are some major Medicaid cuts that just passed, and here's what it means for your aging parent and what you can do about it. Hi there. I am right in the middle of a major move of my household, but this topic is so important and really serious, so I just had to get it out for you. There's a bill that just passed. It's the one that they are calling the One Big Beautiful Bill. And buried inside its 900 pages are massive cuts to Medicaid that could directly affect your aging parent. So I've gone through the fine print, and I want to explain in plain old English what this could mean for you as an adult child who is trying to take care of or support your aging or elderly parent, and how you can try to plan around it. So this bill just passed Congress, and it includes deep cuts to Medicaid. I am talking about hundreds of billions of dollars over the next 10 years. This is not about small tweaks. It is about shifting the foundation of how Medicaid works in our country. And if you're thinking, well, my parent doesn't have Medicaid, so I guess it doesn't affect me or my parent. But stay with me, because most people do eventually rely on Medicaid, especially for long-term care. Medicaid is in the back of the minds of so many people. They're either trying to spend down so they qualify, protect their assets so they qualify, or are planning today to make sure that they qualify 10 years from now, just in case they need it. And the ripple effects of this bill are going to hit almost everyone. And here is something really important to know. These changes, they're not going to all hit tomorrow. Most of the Medicaid-related funding changes and eligibility tightening are expected to roll out gradually between the years 2026 and 2028. That gives you a small window right now to start getting informed and preparing and making some smart moves before the rules get tougher and the services start to shrink. So let me go ahead and break this down by service, because this is where it really gets real and will hit home. The first one is InHome supportive services, that program where the county pays for caregivers to come into the home. That caregiver might be you, or it might be another caregiver coming out to help you out. It will also affect adult day health care services. These are the first programs that states tend to cut when budgets shrink, because technically they are optional under federal law. So this means that there could be longer waiting lists, stricter eligibility, or even just outright elimination of these programs in some states. So if your parent is aging in place, or you're relying on some in-home help to keep them out of a facility, this could make that support just disappear or become really unaffordable or unobtainable. And the assisted living waiver programs, if they're available in your state, also fall under Medicaid funding. This waiver program already has a super long waiting list. In my state here in California, the waiting list is already 1.5 years long. But with funding cuts, it's going to become even harder to get. And some states might just stop offering this program altogether. And then, of course, there's changes to nursing homes and long-term care. This is going to be huge. Medicaid pays for about 60% of all nursing home care in the United States. This bill reduces the provider taxes and caps state reimbursements to the Medicare levels, which is lower, which might sound boring, but really that translates to less money for the facilities. That means we're likely going to see nursing homes close down, reduce their staffing, or authorize shorter stays. And there's going to be fewer beds available. And what's even worse, For the people already living in long-term care, they might be asked to relocate to a different facility if their facility has to shut down or stops accepting Medicaid patients. Now, if your parent is already on Medicaid and they're in long-term care, don't worry, they're not going to get kicked out tomorrow. But here is what could happen. There could be a stricter reauthorization requirements. There could be tighter financial or functional eligibility rules. There's definitely going to be more paperwork and maybe a reduced access to some services within the facility. It's kind of like death by 1,000 cuts. It's not dramatic, but it's going to be disruptive. Now, before we get any further, I want to say something really important. I know there's a lot of judgment out there about Medicaid and the people who are on it. People throw around a lot of phrases out there like welfare recipients, or say that folks who are on Medicaid are abusing the system and we shouldn't have to pay for them. And yes, it's true that there are some young, able-bodied people who have gamed the system. And this bill is working on putting new work requirements in place to address that situation. But the truth is that this often gets overlooked, that Medicaid is really a lifeline for millions and millions of elderly people who are low income and disabled and simply who have no other options. They're not gaming the system. These are our parents and our neighbors. These are people who have worked their whole lives and who have paid taxes and are now aging in a society where long-term care just costs more than their own houses sometimes. Without Medicaid, their care and often your ability to keep them safe at home would collapse. So let's not confuse abuse of the system with essential, compassionate support for the most vulnerable. And if you are caring for a parent right now, you already know this. So if you are an adult child who's already providing part-time or full-time care, or trying to keep your parents safe at home any way you can, worrying about what happens when they need more help in the future, this is going to mean more pressure on you, less support available for you, and higher out-of-pocket costs for you and your parent. And here's the thing, this bill, it didn't include any new support for caregivers, for family caregivers. No tax credits, no additional funding for respite or caregiving, nothing to help you in the process. I was really disappointed. Okay, so take a breath with me now. Let's talk about what you can do. Start the Medicaid conversations early with your parent, even if they don't need it right now. Don't wait until a health crisis happens. Get familiar with your state's Medicaid options now and once these changes are rolled out, especially for home care, the waiver programs, and long-term care eligibility. Get on any waiting list now if you can. And if you are thinking of applying for services like the assisted living waiver program or adult day health care, do it now. The waiting list for these programs will likely grow, and getting in later might not even be an option for you. Start keeping records and documentation because eligibility is going to get stricter. Having detailed financial records of your parents' care needs and medical histories can really make the difference in being able to apply quickly. Keep track of their hospitalizations and their medications and their diagnosis. Have a plan B. Start looking at long-term care insurance if your parent is healthy enough to get it and they can afford the really high premiums. In some states, it is allowable to use your spend-down money on long-term care premiums. And some states, at least currently, have partnerships for long-term care insurance policies, whereas that policy may not be counted towards your parents' assets. This could vary from state to state, so you may want to talk to a Medicaid counselor in the state where your parent lives. If your parent is a veteran or was a veteran, it's time to start looking into whether they qualify for the Veterans Aid and Attendance Program. If your veteran parent has passed away and was married at the time they passed away, then their surviving spouse may be eligible for this monetary benefit as well. I'll put a link to my playlist all about the veterans benefits and how to apply for it in the description box below. Get familiar with your local nonprofits or senior centers or other programs that might provide support to your parents. And start thinking about family as a whole, planning on who can help, in what ways, and when. Talk to your state and local representatives and stay informed about how these changes are going to directly affect your parent. These decisions are often made away from the people who they actually affect, but your voice matters. And this really isn't about politics for me. It's about people like you who are doing your very best to support your aging parent with the love and the time and the limited resources that you have. These changes, they're going to come fast, and I want you to feel informed and empowered and not blindsided. Go ahead and drop a comment below about your thoughts about this big, beautiful bill. And please share this video with someone else who might be caring for their aging parent because it could really help them out. Thank you so much for watching this important video today. I'll see you next time.